Thank you very much. Hello, nice to see you all. So today I've come to talk to you about a slightly different topic, what is truth, and particularly this kind of perspective of a scientist on what is right and wrong. Let's get the technology to work. There we go. What is truth is a phrase that you're probably familiar with. Quid est veritas. This is a Christ before Pilate. And the thing that always strikes me about that particular story is how when Pilate asked the question, Christ answered with silence, which isn't very helpful from a certain perspective, I would say. I will not be answering the question with silence. My lectures would be very dull if that were the case. But it remains, and will always remain, I suspect, a really difficult question, a very important question. Is the truth obvious? Depends what we're talking about. How do we know? And to be honest, does it really matter? So I'm not going to touch on those questions much, but that's the broad context, I think, that we're thinking about. I gave a lecture similar to this a while ago, and these were I've left these ones in. This is from 2018. Truth-seeking scientists. And this is from the US midterm elections in 2018, and they had a little piece on the BBC. And they had this lady, Valerie Horsley. Truth is lacking in the national politics. They say, well, what do you mean by truth? Okay, but if it is lacking and we think it's a good thing, this is a problem. Randy Watkins, they're not making sound policy because they're not using science to make policy. Okay, as if it's like really obvious you should be using science to make policy, which in a sense it is. Surely that's true. But what do we actually mean by that? And I think David will probably cover that sort of thing more than I will. But that's the context when we start asking, you know, what is truth? This is a bit of a caricature. We have on the left the scientific method, and on the right what they call the creationist method. And you can see what it's trying to do. Here are the facts, what conclusions we can draw from them. That's how science works. You get the facts, and then you find out what the truth is, and then you you act appropriately. Whereas on the right, it's back to front, isn't it? Here's the conclusion. We're going to run around and find or invent facts in order to support our conclusion. And you can see what the cartoonist is doing in this case. There's definitely a sense that what's going on the left is good, and what's going on the right is a bit bad, and we need to do something about it. So the whole notion that science is good and religion is just a little bit dodgy, okay? Hello, Dominic and Joe. Very nice to see you. So here are some scientists. I don't know if you've met any of them. My particular favorite is Beaker. That's who I look like and who I model myself on. So do you believe them? Do you just believe someone when they say they're a scientist? Because if you do, I just tell you what I think, and that'll be it. Job done. Okay? Until Dominic gets up, of course. And if you do believe them, why? What is it about a scientist that makes you choose to believe them? Some of them don't have a very good track record. Okay, so this is doctors, scientific evidence about smoking. Yeah? No adverse effects on nose, throat, and sinuses. So that's not very convincing, is it? Here's a good one. This is one of my favorites. You can't see it very well, but this is heroin. From scientific investigations, no other preparation has more successfully withstood such critical scrutiny. That was heroin being marketed as an over-the-counter cough remedy, for which it would be extremely effective. It didn't last very long. Bringing it up to date, there's just every single day in the press, there's something going on. So here's a drug, solanezumab, which may delay Alzheimer's decline. 2015, that one was. So that got the thumbs up. Until, of course, later in 2016, the same drug got the thumbs down because it didn't work. So what about aducanumab? That got the thumbs up too at a certain point. And then shortly afterwards, I had to go elsewhere because the BBC don't seem to like publishing the negative results. But there we can see for Biogen, worst day after they stopped that project. Until, of course, they resurrected it again. And all of a sudden, it's back on the BBC and it's a pass. And great news comes through that this is the first ever drug approved for use in Alzheimer's disease. That's very good news, until, of course, the EU took a look at it and they rejected it. So it's extremely confusing when you start looking at the data and not remotely obvious as you might like to think. Here's another one, crenezumab, just putting in the chronology. This is, I've put this in for two reasons, again, to highlight the fact that the BBC, you'll not find this on the BBC, but that's another one that failed in the treatment of Alzheimer's disease. But here in the title, you can see a key phrase, statistically significant. It didn't pass statistical muster. And the same is true, again, where we see the other so-called failures. This is one of the latest ones, lecanemab. Do you remember that? That was just in the news at the end of last year, but they didn't tell you about the one that was essentially the same sort of thing. This didn't get into the news either, depending on which news you look at, which is gantenerumab, which failed. So we've got this constant to and fro of success and failure with things that look very similar. And this one was in the news just the other week. Did you see this one, donanemab? So this is another one. We could be entering the era of Alzheimer's treatments, you know, but these stories crop up time and time again. And this is one from years ago. I put it up because it's a different type of drug, antidepressants. This, again, was heralded as you know, a great advance, and you've probably heard nothing about it since. And of course, antidepressants are in the news again this week. This is from yesterday. Shocking lack of evidence on antidepressants for the chronic pain, despite the fact that NICE have issued guidance on the use of antidepressants in the management of chronic pain, which is difficult to treat, but there simply is very little evidence to support it at all. So what on earth is going on? Has anyone seen the film? Life is pain, Highness, and anyone who says differently is selling something, and that is certainly true when it comes to pharmaceuticals. So how do they know? What on earth is it that lies behind these claims of success and failure, which seem to be kicked around the pitch like a random football sometimes? And of course, all these terms you'll be familiar with: research, fact, scientific method, peer review, truth-seeking. You sum it up in one word: science. Yeah? Science is what makes the difference. We know what's true. So let's have a think about that. This is my first thought for you. Why most published research findings are false. This paper, published in 2005, you could argue this is what was the birth of what's currently known as the reproducibility crisis. And as we all know, birth is not when something starts. Things are going on behind the scenes before something's born, but it's still there. And then all of a sudden, here we have it. And it's been growing ever since. And the claim lying behind John's essay is explicitly statistical and relates to what I will be talking about, the sort of framework for statistical analysis. And the claim that actually, when you scratch below the surface, there's an awful lot of stuff out there which is not as credible as you might think it is. The replication or reproducibility crisis is now a thing. It's another thing that you don't hear so much on the BBC, which is a shame because it's very interesting and it lies right at the heart of what people like me do as a scientist. The reproducibility of empirical results is an essential part of the scientific method. Yes, it is. So what do we say when people start saying, actually, results that you see in the news aren't reproducible? Is there a reproducibility crisis? This is an article from Nature. It seems to have gone into abeyance a little bit at the moment, but it goes through phases, concerns about these things. This is written by Malcolm MacLeod. He says, science is not done by paragons of virtue. He makes the point that scientists are normal people. Some of them are not very good. And the pattern, he makes this point about promising findings translating into nothing and the equivalent wastage that goes with that. And that, of course, is in some ways the point that many people are concerned about, economics of reproducibility. How much money is wasted simply because of doing science which proves not to be reproducible? Do you believe it or not? What contributes to the research being irreproducible? And when asked in that Nature survey, many of the things that came up related to statistics and experimental design. So that's what we're going to talk about. You know about statistics, lies, damned lies, and statistics. It's one of those things that you can be a little bit cynical about. You can prove almost anything using statistics. Statisticians prove. I can prove anything by statistics except the truth, interestingly enough. And here's a great paper, this is classic, which shows that the more chocolate you consume, the more likely your country is to get a Nobel Prize. Okay? This is one of those amusing papers that doctors occasionally write. We'll see another one later, which actually is very interesting because it's using humor and irony to illustrate points that you ought to know. So yes, but it clearly isn't true, of course. Interestingly, Germany's a bit of an outlier. This is a much more serious claim and paper written by many exceptional statisticians. We'll hear from Stephen Sen again in a moment. Misinterpretation and abuse of statistical tests, confidence intervals, and statistical power has been decried for decades, yet remain rampant. Okay? There is a problem in the use of statistics by scientists. The correct use and interpretation requires an attention to detail which seems to tax the patience of working scientists. This is not subtle writing, yeah, in terms of its critique. And here is a statement, or a little bit from a statement from the American statistician, the American Statistical Association, on p-values. Statisticians and others have been sounding the alarm about these matters for decades to little avail. Okay, whether it has changed at all even since this was written, which is not very long ago, is for other people to judge. But there we have it, p-values. How many of you have heard of a p-value? How many people have never heard of a p-value? Let's have a look. So there are actually, oh, you lucky people. Honestly, I'm going to ruin your day. So p-values are one of those things that scientists use to help them to make judgments about whether they think something's true or not. And essentially what I'm going to try to do over the next half hour is explain to you what they are. Now, we've already established that life is pain, but I'm sorry, statistics is pain too. So it's just the way things are. And anyone who tries to sell you a statistics made easy book, after the first chapter, you will realize that you've only got your money's worth out of about 1/10 of what you've paid for. Stephen Sen, an excellent statistician. I've been studying statistics for over 40 years and I still don't understand it. The ease with which non-statisticians master it is staggering. In his most recent book, at least the most recent book I've got, he has a definition of statistics. He says, statistics, a subject which statisticians find difficult and which almost all physicians are experts in. So instead of talking about statistics, I'm going to talk about toilets instead. The latrine questions. Anyone recognize this? There is at least one person in this room who should recognize this. Hmm? Is it in Bath? No, no, it's not in Bath. It's not Oshaw. No. It's Rome. It's Ostia Antica. Okay, and there is a person in this picture which somebody here should recognize as well. Do you not recognize it, Dominic? Yeah, see, just there. You might not be able to see it, but right here, there's a little finger. Is that finger there? That is Justine. That's your sister. Believe it or not. Many, many years ago, I was looking around Rome with Dominic's sister, and we went to Ostia Antica, and this is the big posh latrine that the important people would go to, and the Senate was up on the hill. And of course, they would come and bloot themselves first thing in the morning, and they would do it communally, as you can see. It was quite so I'm led to understand. And I saw this and thought, ugh. But also saw this bit here, because I was just thinking, look, you might be very fussy if you're in a toilet who you choose to sit next to before you go up to Parliament. You know, do you want to really sit next to Donald Trump or Jeremy Corbyn or someone like that, you know? So you might think, I don't want to share my personal space in the latrine with this person. And here you can see there's a partition because it's broken. So obviously this latrine and that latrine are not connected. Whereas you don't know whether these latrines are connected at all. Unless you break it, you're not allowed to do that. It says don't break the latrine just outside. And I thought, do you know what? That's just what's going on with statistics. So the question I want you to focus on and always come back to when you're starting to struggle a little bit conceptually is the latrine question. And this is the question. Is there a partition between my latrines, A and B, in here? All statistical hypothesis testing can be brought back to this question. Okay, so start with this. Now, how do you go about answering that question? You're not allowed to vandalize the latrine. Okay, you can't break it. So instead, you have to put on a pair of gloves and you have to sample from A and B and you take a look at what comes out of A and B and you make a judgment based on what you see. Okay, do they look the same? Do they look different? Now, the one question gives rise to two hypotheses. The first hypothesis is that we have a communal latrine, no partition. We can't actually see inside, but that's what we could see if we could. So when we sample from A and B, we're going to expect to see something that looks roughly the same. It doesn't have to be exactly the same. You know, it's like putting your hand in your sock drawer. You don't necessarily expect to always get left and right ones. But it'll be roughly the same. Whereas the alternative hypothesis, the private latrine, you've got a partition. Now, in this case, the samples could look different. They could still look the same because the contents of the two sides of the latrine might be quite similar. Okay, but they stand the chance of being different. Got it? So far, so good. Stick with the latrine. Stick with me here, folks. There are 4 outcomes to this question, and it's very similar to what goes on in a criminal trial, at least the criminal trials that I watch on TV. So on the TV, the defendant is either guilty or not guilty. And then there's a jury, and the jury examines evidence, at the end of which they say guilty or not guilty, which means there are 4 possible outcomes, of which 2 are good, guilty, guilty, not guilty, acquitted, and 2 of which are bad. Okay, so the not guilty person is convicted, that's not very good, or the guilty person is let off, that's not ideal either. So we might say in this context that our null hypothesis is the equivalent of the presumption of innocence. We start with the presumption of innocence. And our alternative hypothesis sort of relates to this concept of beyond all reasonable doubt. And of course, it will all come down to what constitutes reasonable. So if we apply this to the latrine, the no partition latrine is our presumption of innocence. No partition, presumption of innocence, and the partition is our beyond all reasonable doubt. So it's exactly the same again. In reality, there is either a partition or not. We examine the evidence and then we make a judgment, partition or not. So again, there are 2 good outcomes. We say there's a partition when there is. We say there's no partition when there isn't. And there are 2 bad outcomes. Now, statisticians have a way of distinguishing between these 2 different types of mistake, and they call them type 1 and type 2 errors. In an attempt to help students to remember which one's which, I've always said, well, type 1's obviously worse than type 2, isn't it? Because it's a type 1 error rather than a type 2. So think of it in terms of hanging the innocent man. This is terrible, surely. So I've in the past, I'm not going to do this now because I think audience participation is hopeless. You ask them who thinks which is worse, convicting an innocent person or acquitting the guilty person. And much to my consternation, what I thought was a really obvious question is not quite as obvious as you might think. So it doesn't really help you to remember it. But if you happen to think that convicting an innocent person is by far worse than letting off the guilty person, then go with type 1 error as being the more serious of the errors. So we have 2 possible realities. Okay? Either there is no partition or there is a partition. We haven't got both at the same time. This is not Schrödinger's cat. Okay, so this is either that or that. Okay, where's my little button gone? There we are. It's disappeared. There we are. Or the partition. Now, it would be really nice to know how likely is it that we're going to make this mistake. So when we are in reality 1, and remember we don't know we're in reality 1, if we did we wouldn't need to do the experiment, but when this is in fact true, what's the chances we're going to make the wrong decision? And statisticians like to speak in Greek, and indeed so do theologians, so you should cope with this. And they call the probability alpha. So the probability of getting it right is 1 minus alpha, because all probabilities add up to 1. So when there's no partition, you're either going to get it right or you're going to get it wrong, and if you get it wrong, the probability we call alpha. So you can probably guess what's coming next. When there is a partition, you can either get it right and say there's a partition, or get it wrong and say there's no partition. What's the probability you're going to get it wrong? Any guesses as to what they call it? Cute. Beta, for those of you who are being sensible. Okay, so this is beta, and this is 1 minus beta. So a good latrine test, if you like a good statistical test, is going to be one that defines, minimizes, and balances alpha and beta. It's very easy to make either alpha or beta 0. You just let everyone off, or you convict everybody. And one of these will become 0, but of course you can immediately see what the problem with that is. Okay, so these things are going to be balanced, but also it's important that they're quantified reliably, and of course as small as we can possibly make them. So type 1 errors and alpha are related. What is alpha? So alpha is the probability of convicting a defendant who is really, truly innocent. It's the probability of concluding there is a partition when there is not a partition in my box. How on earth does that happen? That happens because we get what you might call misleading evidence. We sample from A and B, and we get something like that. So here, there's no partition. We're just sampling from the same pot. Is it possible that you could just sample red out of A and blue out of B? Yes, it is possible, but it's a bit unlikely. And the key question is, how unlikely? How unlikely does it have to be? Because if you saw that, you might think, oh, there's something going on here. Okay? So the question is, how unlikely does it have to be the result you see before you are prepared to say, do you know what? I'm not sure anymore that this has got no partition. In other words, what is beyond reasonable doubt? Now that burden of proof is chosen by you as a statistician or as a scientist. So this is the bit where we have audience participation. Anyone who's done any of those modules on how to teach are told that at some point you've got to get the audience involved. Okay, so help me here. We've got a coin. I've got a coin here. Okay, and it's 50-50, heads, tails. And the question is, how many consecutive heads or tails would you have to toss with your coin? There we go. There's the tails. There's a heads. So it's got one of each. Before you are prepared to say, actually, hang on a sec, there's something a little bit fishy with this coin. So I want you to think about that. Imagine you're tossing a coin and you get heads, 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 or tails. At what point do you say, hang on, Gov, I don't trust this. There's something funny going on. Okay, so have a little think about that, and then I'm going to ask you. Okay, anyone have an answer for me? 10. Thank you. Anybody go higher than 10 before they would get concerned? 10?
What's the value on the outcome? Well, it depends on the argument. If I'm losing the bet, then it's against me.
Okay. What would just trying to establish what to you constitutes improbable. Yeah? What your burden of improbability is.
I think 9 or 10 is about.
9 or 10, yeah?
I think it's different with a coin or with a dice, because I don't understand how it's supposed to be fixed. So I think I'm used to thinking of a loaded die, and I didn't understand how that might work, and I just don't understand unless I think that there's a magician who's.
Well, there's all sorts of things you can do.
Then you can stop fooling me at another point. So I'd like to have a sense of what.
Okay, but at what point? At what point? How do you know it's not a two-sided coin? Do they exist?
Yeah.
So at what point you're going to say, "Hang on, Gavin, hang on, enough's enough."
For a two-sided coin.
I mean, are you even able to tell? I mean, you can throw it 1,000 times, and it could always come up heads. You could say that shows it's a dodgy coin.
Okay,
But
1,000.
But you don't know what the next 1,001's going to be.
Well, if somebody tossed a coin 1,000 times and asked me what's going to come up next, I would say 1,000 heads. Because 1,000 tosses of the same thing is so vanishingly. I don't think anything in the universe has ever happened that's as improbable as that.
I would go for a low number, maybe go 4 or 5.
4 or 5. 4 or 5. Interesting, isn't it? Well, the conventional answer is 6. And that's because it comes in below 5%. The probability of either getting 6 consecutive heads or 6 consecutive tails is 3.1%. The probability of getting 10, I can't remember, I don't know what it is, you can do it in your head in a minute. It's pretty low. But the moment you get up to 50 or 100, it's just vanishingly small. It's so improbable that at some point you would say enough's enough. This is the burden of proof. Well, 5% is the burden of proof that is conventionally used in order to say something is awry. Okay, so something coming out of there, so obviously those balls are highly unlikely, and there's a whole range of outcomes that are either likely or unlikely. On average, you'd expect to see half and half. But it's the 5% least likely outcomes that are going to make you stand up and say, I think there might be something going on here. And we call that significant, statistical significance. And it's a choice. So what that means, and again, the context within which you're making this decision is, of course, critical. In this context, I suspect most people would think that that is not really acceptable, because that is the burden of proof we're using. For every 20 innocent people before the court, you are going to convict one of them, 1 in 20 on average. And you can't get around it unless you choose to change that burden of proof. Why is it 5%? Well, this goes back to mostly, I would say, Ronald Fisher and the development of this approach to analyzing data, which was developed in agricultural context. And he tells us either there is something in the treatment, or, in other words, either there's something dodgy about the coin, or a coincidence has occurred such as does not occur more than 1 in 20 trials. He just said, well, that's the kind of level of implausibility, 5%. He recognizes that some people might think that's a bit high. He says, well, if you want to make it 2 or 1%, that's your business, that's fine. Personally, he likes to ignore everything that comes in as above 5%. And this is something that I drill or try to drill into my students. A scientific fact should be regarded as experimentally established only if a properly designed experiment rarely fails to give this level of significance. Design, power, and significance are key parts of all of this, and mostly if you're only hearing about p-values, you only hear about the significance. But the power, which I'll talk about in a moment, is essential, and the design I'm not really going to talk about at all because we don't have time. So type 2 errors and beta, we did type 1 and alpha. What is beta? Beta is the probability of acquitting a defendant who is really guilty. It's the probability of concluding there is no partition when in reality there is a partition. And how does that occur? It occurs when we have insufficient evidence, and we call that power, insufficient statistical power. It's when we sample from A and B, we've got a partition, the contents are kind of slightly different there, but we sample and we look at what comes out and you think, how different? Is it different enough? No, it's not. It doesn't pass that threshold of alpha equals 0.05. So how can you make it cross that threshold? And the answer is to sample sufficiently from your latrine. And the whole issue of how much data you need in order to come up with a credible conclusion is quite a challenging one. But in principle, you want to collect as much evidence as you need. Typically, when experiments are designed appropriately, people will aim for a power of roughly 80 to 90%. That means your beta's around 10 to 20%, so it's a little bit skewed. But if you collect too little evidence, if you only sample a couple of balls from either side, there's just no point in doing it. The test becomes pointless because the probability of getting a significant result starts to get down towards your alpha level, your guarantees to get at least 5% significant results. So how powerful is science, particularly the science that I would do? There is a very strong suggestion that most experiments that are done, particularly in laboratories, are thoroughly underpowered. This is just one meta-analysis of neuroscience, and you can see there's this sort of bimodal curve. There's a handful of people who look as though they're doing it okay, but the conclusion is quite distressing, that the average statistical power of studies in the field of neuroscience is probably no more than 8, somewhere between 8 and 31%. And remember, the power you would get if there is nothing going on, when you know there's nothing going on, is 5%. It's going to be here. So this is a sorry state of affairs in terms of what's going on. And this is one of the principal reasons why many results seem to be irreproducible. This is a word definition of a p-value from the American Statistical Association, and this is what happens, I'm afraid, when you ask statisticians to put things into words. They call this informal. It's a probability under a specified statistical model that a statistical summary of the data, for example, the sample mean difference between two compared groups, would be equal to or more extreme than its observed value. Have you got that? I'll be asking questions later, so I'm going to try and explain that. The key thing to remember is the p-value always refers to the null hypothesis. So the specified statistical model they're referring to is the null hypothesis. It's my latrine with no partition. It's the probability, assuming that that's the kind of situation we're looking at, the statistical model. That a statistical summary of the data, now the statistical summary of the data is determined by the structure on top, the two sample holes. I'm going to get two different samples, and I could turn them into a mean, or in this case it's a count. Counts of red and blue, counts of red and blue. Would be equal to, I mean, do remember the p-value even here is referring to the null hypothesis. Okay? What's the probability we would get this if that were true? And of course, it's the probability of that plus anything more extreme than that. So more extreme than this would be, for example, 4 reds and 4 blues. That's even less likely than that would be. So that's what it's trying to do. And of course, what you can see is that on both sides, you get a right answer and a wrong answer, and a right answer and a wrong answer. And the key thing you've got to remember is that when we look at the data, we don't know what's going on. We just see the data. And based on the data, we calculate a probability which references what we would expect to see if the null hypothesis were true. So when the probability is very low, we conclude that there is a partition. In this case, it's wrong. In this case, it's right. Get the idea? Here's an example. Does aspirin work? And I mean, in this case, does aspirin work taking it to stop you having a heart attack? So it's actually the 1950s when this is first suggested, long before anybody really knew how aspirin worked. This chap, who was a doctor in the Midwest of America, published a few little minor papers, noticed that his patients, he was getting patients who they had dental extractions, and if they were on aspirin, they just bled quite a lot. And he connected the excess bleeding with reduced thrombosis. And so he said, oh, try taking an aspirin. And actually, his conclusions in terms of dose were pretty good. His conclusions in terms of effectiveness were probably not, because he claims none of his patients had a heart attack who he put on aspirin. But either way, the first clinical trial looking at aspirin was 1974. And you can see the cumulative deaths of placebo and aspirin is just a little bit lower after a while. So you do seem to see a reduction, but the conclusion was inconclusive. The results of the trial were inconclusive. None of the difference detected were statistically significant at the conventional, that is to say, 5% levels. So what's going on here? Is this because there is no effect, there's no partition, or is it a type 2 error? We simply don't have enough data. So it's either this one or that one. How do you know which one is true? Well, of course, one approach, if you think it's interesting and important enough, is to go and do another clinical trial and make your sample size bigger. And to cut a long story short, in 2002, a meta-analysis, which is an analysis of analyses, different studies, concluded that there is a real effect of aspirin in this effect. And you can see the p-value down there is very, very low. It's less than 0.0001. The size effect is not as big as you might think. And that's why lots of people, including myself, have spent more than a few years of their life working on drugs to do better than aspirin. So, does aspirin work? The simple answer is yes, we think aspirin does work. Here's another interesting question for you. Does prayer work? So this is a study that was published in the BMJ, and it's on remote retroactive intercessory prayer and outcomes on patients with bloodstream infection. Do you remember this one? So this is a great paper. Okay, now what these chaps done, this was done in Israel. He's decided, he said, right, we're talking about prayer to a divine being here, so he's clearly not confined by the limits of time. So in order to get around the whole problem of ethics, and that's an issue as well, he decided to identify a group of patients who were admitted to the hospital over a 10-year period in the past. And he identified all the patients who were admitted with a bloodstream infection. He randomized them into two groups, a prayer group and a placebo group, and then asked some local groups to pray for the patients in the prayer group in order to see, and that after that happened, he then analyzed the data. And lo and behold, he got a significant result. The primary outcome, which was survival, was not significant, but this one was. The stay in hospital was reduced, and the duration of the fever was reduced, and there is your significant result. Okay. Now, is this a real effect? If it is a real effect, it raises all sorts of questions, because you can then go and apply the same intervention, of course, to the placebo group. Or is it what we call a type 1 error? Now, of course, for me, I would say this is evidence of the existence of type 1 errors. But of course, you don't need evidence of the existence of type 1 errors because they are built into the very framework of this approach to evaluating data. But we've got a significant result. We've concluded there's a partition. Which is true? Is it a chance finding or is this a real effect? They happen. Chance findings happen. There were some interesting responses to this paper. Leibovitch himself sort of raised his eyes to heaven and said, come on, the purpose of the paper was to ask the following questions. Would you believe it if it looks methodologically correct, even though it makes no sense within our kind of frame? And then other people said, oh yeah, these people are interested in parapsychology and paranormal. Said there are funded, important, large studies on these kind of things which demonstrate it's real, including Leibovitch. And you think, oh God, no. So this then promotes a whole new area of study in the social sciences where they say actually publishing ironic science is maybe quite dangerous because some people will believe it. Of course, there was a big clue to this one because this one was published in the Christmas edition of the BMJ, which is notorious for publishing slightly entertaining and slightly odd things, and this particular study was also published on the same page as Rudolph the Red-Nosed Smear Test. So this is what makes doctors chuckle. So the conclusion is no single index should substitute for scientific reasoning, and certainly not p-values. They're part of the story, but only part of it. Now here's another example, I think it's my last example, and this, you may remember, was all over the news in the summer of 2017. And this, it was published in Nature, which is reputedly a good journal, and the copy comes down. It potentially opens the door to preventing 10,000 disorders that are passed down the generations. So this is genetic modification of human embryos. This is why it's all over the news, and it's going to save the planet from every disease you can possibly imagine. For example, cystic fibrosis and breast cancer. Okay, let's have a closer look at this paper, shall we? Here's the statistics. Just highlight one bit. One-tailed Fisher's test was used for comparisons in 2 figures. Don't worry about the other bits. I'll show you the 2 figures. This is figure 2F. And the outcome they would expect without their genetic intervention is roughly 50%. That's the control embryos. And as you can see, they get an improvement. With these sort of S-phase injected embryos, this is a way of delivering the genes. You get an improvement. Okay, and they tell us it's a substantial increase. Now, it's not like a scientist to say substantial increase without saying statistically significant increase. So is this, in fact, a significant increase? Well, they've done this test, and you might ask why it's one-tailed. I might come back to that. But why was the statistical test not reported? Well, because that's the result. They give us the data. This is not statistically significantly different. Whether it's real or not, of course, is another matter, but it certainly doesn't pass the conventional muster, so to speak. It's also slightly cockeyed. I don't know if you can see that, but the bar is wrong, and for the life of me, I don't know how they've managed to do that, because 66.7% is not there. So this is graphically misleading as well as statistically misleading. This is the M-phase injected embryos in a different figure. And now they do tell us it's significantly higher, and now we have our reason for why they're using one-tailed tests, because if they did a two-tailed test, which they frankly should be doing, because it could go down as well as up in principle, they would have got a non-significant result. So they've absolutely squeezed the pips out of this in order to say that this is real. Of course, I said I wouldn't talk about design, but this is a design issue too. What they really should have done is compared 3 individual distinct treatments on different embryos. So actually, this is the equivalent, if you like, latrine they should have been evaluating, and if they'd done that, they would have got, again, another non-significant result. They go on to tell us that the M-phase delivery of the gene, this is the CRISPR thing, you might have heard of CRISPR, it's all terribly fashionable, provides more efficient targeting. They're saying that one is more efficient than that one. Anyone believe that? They certainly don't say statistically significant, and if they had done a Fisher's exact T, says there's absolutely nothing going on here at all. So this is not good, and this is Nature. All over the news. If you go and look at this paper, you'll see there's an expression of concern at the very bottom, which has been there since almost the very beginning, but it hasn't been resolved. It's still there, published. Do you believe it? No statistical methods were used to predetermine the sample size. In other words, they didn't stop and think, how many embryos do I need to do in order to evaluate this hypothesis? They tell us this instead. We used a minimum number of human oocytes required for statistical comparisons, which in my head sounds like they kept going until their statistical test tipped over the boundary of 0.05, which would enable them to say it's statistically significant. Now, this is Malcolm MacLeod, and he's talked about these issues for a long time. And in this particular lecture, he's talking about this paper, which is published in another Nature Communications. And they describe their sample size. How do they decide how much evidence to collect? We continuously increased the number of animals until statistical significance was reached to support our conclusions. as he says, that is not a sample size calculation. That's called cheating, because if I had another hour with you, and you're probably glad I don't, I would explain to you why when the empty latrine, the no partition latrine is real, if you just keep sampling and you've got the patience to keep doing it, you will absolutely 100% hit your statistical significance boundary. Former editor of the BMJ tells us most scientific studies are wrong, and they're wrong because scientists are interested in funding and careers rather than truth. Again, that's a pretty brutal claim, I know. You can read that one for yourself. Malcolm MacLeod refers to scientists as not paragons of virtue. They're just like other people. The natural select. How do we end up in this situation? Poor methods get results. In fields such as psychology, neuroscience, and medicine, practices that increase the false discovery rates remain not only common, but normative. Students get taught to do this stuff. Part of the problem is that no one is incentivized to be right. That's the background culture of what's driving a lot of what goes on in biomedical research, such as the stuff that we saw at the beginning. Less so, I would say, I hope, in clinical research. Anyone remember that one? The truth is out there. I want to believe. Scientists want to believe their hypotheses. I'm in the fortunate position that almost all the hypotheses I've ever come up with, I've managed to show are not true, or else somebody else has came up with them before. So it seems to me that there is a credibility issue when you come back to this notion of what do I choose to believe and why. And the scientists have a particular position in society at the moment. One might also almost say that they are our modern 21st century priesthood. Scientist speaks, people believe. Just listen to the way they get interviewed very often on the radio. And of course, it's not difficult usually to find a scientist who will come and argue with the other one, and they quite enjoy doing that. This is my last slide. We tend to believe the truth is in there, but sometimes it isn't, and the danger is we will find it anyway. Okay? And that is part of the problem. Do you want to believe, or do you want to find the truth?